CEN written exams be like? Question 1. A patient with a suspected myocardial infarction has a cardiac arrest. The ECG shows ventricular fibrillation. After the first defibrillation attempt, what is the next step? Option A. Resume CPR immediately for 2 minutes. Option B. Administer epinephrine 1 mg for. Option C. Administer amiodarone 300 mg for. Option D. Check a pulse. The correct answer is option A. Resume CPR immediately for 2 minutes. After defibrillation for VF/pulseless VT, the ACLS algorithm directs an immediate return to CPR for 2 minutes, 5 cycles, before checking the rhythm and pulse. Epinephrine is given after the second shock. Amiodarone is given after the third shock. High-quality CPR is essential for outcomes. Question 2. A patient presents with suicidal ideation and a specific plan to overdose on pills. The CEN should. Option A. Ask the patient to sign a no-harm contract. Option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Option C. Discharge the patient home with a safety plan. Option D. Administer a benzodiazepine to calm the patient. The correct answer is option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Patients with suicidal ideation with a specific plan require 1:1 observation, suicide precautions, and a legal psychiatric hold, 5150, Baker Act, etc. A no-harm contract is not sufficient and may provide a false sense of safety. Discharge is contraindicated. Benzodiazepines may be used for agitation but are not the primary intervention. The CEN should remove all potential self-harm items, sharp objects, belts, etc., and ensure constant observation. Question 3. A patient with a DNR, do not resuscitate, order is in cardiac arrest. The CEN should. Option A. Start CPR immediately. Option B. Confirm the DNR status and not start CPR. Option C. Call the family for permission. Option D. Ask the patient's primary nurse. The correct answer is option B. Confirm the DNR status and not start CPR. If a patient has a valid DNR order, advance directive, the healthcare team should not initiate CPR. The CEN should confirm the DNR status before withholding CPR. If the DNR is not immediately available, the CEN should initiate CPR unless the patient's status is known and documented. The family's permission is not required if the DNR is valid. Question 4. Which finding is most concerning in a patient with acute abdominal pain, suggesting peritonitis? Option A. Rebound tenderness and guarding. Option B. Nausea and vomiting. Option C. Diarrhea. Option D. Fever. The correct answer is option A. Rebound tenderness and guarding. Rebound tenderness, pain upon release of pressure, and guarding, involuntary muscle stiffness, are signs of peritonitis, indicating peritoneal irritation. These are surgical red flags. Nausea, vomiting, diarrhea, and fever are nonspecific and can be seen with many abdominal conditions. CT imaging can help confirm the diagnosis: appendicitis, diverticulitis, perforation, or bowel obstruction. Question 5. A patient presents with sudden, painless vision loss in one eye. Which diagnosis is most likely? Option A. Central retinal artery occlusion, CRAO. Option B. Retinal detachment. Option C. Acute angle closure glaucoma. Option D. Optic neuritis. The correct answer is option A. Central retinal artery occlusion, CRAO. CRAO presents with sudden, painless, monocular vision loss. It is an ophthalmic emergency requiring immediate evaluation for a source of emboli. The patient may have a cherry red spot on the macula. Treatment includes ocular massage, lowering intraocular pressure, IOP, and possibly thrombolysis if the patient is within the window. Retinal detachment presents with flashing lights and floaters. Question 6. A patient with a suspected stroke has a blood pressure of 190/105 mmHg. The CEN should: Option A. Administer 4-labetalol to lower blood pressure. Option B. Permit hypertension unless the patient is receiving TPA. Option C. Administer sublingual nifedipine. Option D. Start a nitroprusside drip. The correct answer is option B. Permit hypertension unless the patient is receiving TPA. In acute ischemic stroke, hypertension is often permissive to maintain cerebral perfusion pressure, CPP, in the ischemic penumbra. Routine blood pressure lowering is not recommended unless the patient is a candidate for TPA, in which case BP should be lowered to 185/110 mmHg before TPA administration. After TPA, BP should be maintained 180/105 mmHg. Question 7. A patient with frostbite to the fingers should be managed with: Option A. Rapid Ruhrmeng in water at 37 to 40 degrees Celsius. Option B. Dry heat, e.g., warm blankets. Option C. Massage to the affected area. Option D. Surgical debridement. The correct answer is option A. Rapid Ruhrmeng in water at 37 to 40 degrees Celsius. Frostbite is managed with rapid Ruhrmeng in warm water at 37 to 40 degrees Celsius, 98.6 to 104 degrees Fahrenheit, for 15 to 30 minutes. Ruhrmeng should be done until the tissues are thawed. Analgesia is needed due to pain. Dry heat, e.g., warm blankets, is not recommended as it can cause burn injuries. Massage can cause tissue damage. Surgical debridement may be necessary after Ruhrmeng if necrosis occurs. Question 8. A patient presents with a bowel obstruction, nausea, vomiting, abdominal distension, and obstipation. Which imaging study is preferred? Option A. Abdominal X-ray. Option B. CT scan with oral contrast. Option C. Ultrasound. Option D. MRI. The correct answer is option B. CT scan with oral contrast. CT with oral and 4 contrast is the preferred imaging for suspected bowel obstruction, as it can identify the location, cause, and complications of obstruction. Abdominal X-ray may show air fluid levels but lacks specificity. Ultrasound and MRI are less sensitive. Management includes NPO status, NG tube placement, 4 fluids, and surgical consultation. Question 9. A patient with a communication barrier, e.g., non-English speaking, deaf, requires interpretation. The CEN should: Option A. Use a trained medical interpreter. Option B. Use a family member. Option C. Use a bilingual staff member. Option D. Use a phone interpreter. The correct answer is option A. Use a trained medical interpreter. Effective communication is essential for patient safety and ethical care. A trained medical interpreter, in person, phone, or video, should be used to communicate with patients who have a language barrier or are deaf. Family members or friends should not be used for medical interpretation due to the potential for errors and breaches of confidentiality. Bilingual staff who are trained as interpreters are acceptable. Question 10. A patient with a corneal abrasion should receive which treatment? Option A. Antibiotic eye drops. Option B. NSAID eye drops. Option C. Cycloplegic agents. Option D. All of the above. The correct answer is option D. All of the above. Corneal abrasion, scratch on the cornea, is treated with topical antibiotics, to prevent infection, NSAIDs, for pain, and cycloplegic agents, to reduce ciliary spasm and pain. A patch may be used for comfort but is not always recommended. A slit lamp examination with fluorescein staining confirms the diagnosis and rules out a foreign body or ulceration. Question 11. What is the chain of custody in the context of forensic evidence? Option A. The sequence of people who handle a sample, ensuring it is not tampered with. Option B. The chain of command in the ED. Option C. The medication administration record. Option D. The patient's medical records. The correct answer is option A. The sequence of people who handle a sample, ensuring it is not tampered with. The chain of custody is the documentation of every person who has handled a piece of evidence, e.g., blood, urine, clothing, from the time it is collected until it is presented in court. Maintaining the chain of custody ensures the evidence is not tampered with, lost, or contaminated. This is crucial in forensic cases, sexual assault, violence, etc. Question 12. A patient presents with chest pain, shortness of breath, and pleuritic pain. Vital signs: HR 110, RR 24, SpO2 88% on room air. The patient recently had knee surgery. Which diagnosis is most likely? Option A, myocardial infarction. Option B, pulmonary embolism. Option C, pneumothorax. Option D, pericarditis. The correct answer is option B. Pulmonary embolism. This patient has risk factors for VTE, recent surgery, immobility, and presents with the classic triad of dyspnea, chest pain, and hypoxia. Pulmonary embolism, PE, should be suspected. Wells criteria and PERC rule can help stratify risk. CTA is the diagnostic test of choice. Anticoagulation should be initiated promptly if PE is confirmed or strongly suspected. Question 13. A patient with a known abdominal aortic aneurysm, AAA, presents with sudden onset of severe back pain and hypotension. What is the priority action? Option A, obtain a stat abdominal CT. Option B, prepare for emergent surgical repair. Option C, administer 4 fluids to restore blood pressure. Option D, obtain a 12-lead ECG. The correct answer is option B. Prepare for emergent surgical repair. Sudden back pain and hypotension in a patient with a known AAA is a ruptured AAA until proven otherwise. This is a surgical emergency. Immediate surgical consultation is the priority. CT may confirm but should not delay surgical preparation. 4 fluids should be given cautiously, permissive hypotension, to avoid increasing bleeding before surgical control. ECG is not the priority. Question 14. A patient presents with a fractured ankle, severe pain, and inability to bear weight. Which intervention is appropriate? Option A, apply a splint and elevate the leg. Option B, apply a cast and discharge the patient. Option C, administer 4 antibiotics. Option D, apply a tourniquet. The correct answer is option A. Apply a splint and elevate the leg. An uncomplicated ankle fracture should be splinted, not casted, to allow for swelling, and the leg should be elevated to reduce swelling. The patient should be evaluated for a fracture and the neurovascular status documented. Casting is not appropriate until swelling has resolved. Antibiotics are not indicated for closed fractures. Question 15. What is the Glasgow Coma Scale, GCS, score for a patient who opens eyes to pain, makes incomprehensible sounds, and has abnormal flexion, decorticate, posturing? Option A 10, E2V2M4. Option B 8, E2V2M3. Option C 7, E2V2M3. Option D 9, E3V2M4. The correct answer is option C. 7, E2V2M3. GCS assesses eye opening, E2 to pain, verbal response, V2 incomprehensible sounds, and motor response, M3 abnormal flexion/decorticate. 2 plus 2 plus 3 equals 7. A GCS 8 generally indicates the need for airway management, intubation. GCS is used to monitor neurological status in patients with head injury or stroke. Question 16. A patient with acute cholecystitis presents with right upper quadrant pain, nausea, vomiting, and fever. Murphy's sign is positive. Which diagnostic test is preferred? Option A, abdominal ultrasound. Option B, CT scan. Option C, HITA scan. Option D, X-ray. The correct answer is option A. Abdominal ultrasound. Ultrasound is the diagnostic test of choice for acute cholecystitis, showing gallstones, gallbladder wall thickening, and pericholecystic fluid. Murphy's sign, pain on deep inspiration while palpating the right upper quadrant, is a classic finding. Treatment involves NPO status, 4 fluids, antibiotics, broad spectrum, and cholecystectomy. CT may be used if complications are suspected. Question 17. A patient with sepsis has a MAP of 55 mmHg despite fluid resuscitation. The CEN should anticipate which vasopressor? Option A, dopamine. Option B, norepinephrine. Option C, phenylephrine. Option D, epinephrine. The correct answer is option B. Norepinephrine. Norepinephrine is the first-line vasopressor for septic shock. It increases MAP through vasoconstriction and is preferred over dopamine due to a better safety profile. The sepsis protocol recommends early broad-spectrum antibiotics, within 1 hour, 30 ml/kg crystalloid, and vasopressors for fluid refractory shock. MAP target is 65 mmHg. Question 18. A patient with a suspected globe rupture should: Option A, have the eye patched and the patient placed NPO. Option B, have the eye examined with a slit lamp. Option C, be given 4 antibiotics. Option D, be discharged with a follow-up. The correct answer is option A. Have the eye patched and the patient placed NPO. Globe rupture is a surgical emergency. The eye should be patched with a shield, not pressure, to prevent further injury. The patient should be NPO for possible surgery. Ophthalmology consult is needed. Slit lamp examination should be done cautiously if a rupture is suspected. Antibiotics may be given prophylactically. Discharge is contraindicated. Question 19. Which of the following is an ethical principle in emergency nursing? Option A, beneficence, doing good. Option B, non-maleficence, doing no harm. Option C, autonomy, patient's right to decide. Option D, all of the above. The correct answer is option D, all of the above. The core ethical principles in emergency nursing include beneficence, doing good for the patient, non-maleficence, avoiding harm, autonomy, respecting the patient's choices, and justice, fair treatment. These principles guide nursing practice and decision-making. The CEN should respect these principles in all patient interactions. Question 20. What is the correct compression to ventilation ratio for adult CPR with an advanced airway in place? Option A, 30:2. Option B, 15:2. Option C, continuous compressions at 100-120/min with breaths every 6 seconds. Option D, continuous compressions at 80/min with breaths every 8 seconds. The correct answer is option C. Continuous compressions at 100-120/min with breaths every 6 seconds. When an advanced airway, ET tube or supraglottic airway, is in place during adult CPR, continuous chest compressions at a rate of 100 to 120 per minute are delivered without interruption for ventilations. 1 breath is given every 6 seconds, 10 breaths/min. The 30:2 ratio is for CPR without an advanced airway. Question 21. A patient has a left-sided stroke. The CEN should anticipate: Option A, right-sided weakness and expressive aphasia. Option B, left-sided weakness and neglect. Option C, right-sided weakness and impulsivity. Option D, left-sided weakness and aphasia. The correct answer is option A, Right-sided weakness and expressive aphasia. A left-sided, dominant hemisphere, stroke typically results in right-sided hemiparesis and aphasia, expressive or receptive. A right-sided stroke causes left-sided weakness and neglect, ignoring the left side of the body and environment. This knowledge helps prioritize interventions, including swallowing assessment, dysphagia, speech therapy, and fall prevention. Question 22. A patient presents with a foreign body sensation in the eye, tearing, and photophobia. The CEN should: Option A. Use a slit lamp to examine the eye. Option B. Perform fluorescein staining and a slit lamp exam. Option C. Irrigate the eye. Option D. All of the above. The correct answer is option D. All of the above. A corneal foreign body or abrasion requires a thorough examination under a slit lamp with fluorescein staining to identify the location and extent of the injury. Irrigation may be needed to remove loose foreign bodies. The CEN should identify and remove the foreign body if visible or refer to ophthalmology for removal. Antibiotics are often prescribed. Question 23. A patient with SVT has failed vagal maneuvers. The CEN should prepare to administer. Option A. Adenosine 6 mg 4 push. Option B. Atropine 1 mg 4. Option C. Epinephrine 1 mg 4. Option D. Amiodarone 300 mg 4. The correct answer is option A. Adenosine 6 mg 4 push. Adenosine is first line for stable SVT. It is given as a rapid 4 push, 1 to 2 seconds, followed by a 20 ml saline flush. Atropine is for bradycardia. Epinephrine is for cardiac arrest. Amiodarone is for ventricular arrhythmias. Adenosine works by transiently blocking AV node conduction. Question 24. A patient presents with a panic attack, shortness of breath, chest tightness, and paresthesia. The CEN should: Option A. Apply a paper bag to rebreathe CO2. Option B. Provide reassurance and instruct the patient to take slow breaths. Option C. Administer a benzodiazepine. Option D. Perform an ECG. The correct answer is option D. Perform an ECG. Chest pain and shortness of breath in any patient should be evaluated for medical causes, ACS, PE. An ECG, vital signs, and appropriate labs should be done. While panic attacks are a common cause of hyperventilation, the CEN should not assume this without ruling out life-threatening conditions. If organic causes are ruled out, reassurance and breathing exercises are helpful. Question 25. A patient presents with severe crushing chest pain. The ECG shows ST segment depression and T-wave inversion in leads 2, 3, and AVF. This is most consistent with: Option A. Anterolateral STEMI. Option B. Inferior STEMI. Option C. Non-ST elevation myocardial infarction, NSTEMI. Option D. Pericarditis. The correct answer is option C. Non-ST elevation myocardial infarction, NSTEMI. ST segment depression and T-wave inversion without ST elevation indicate NSTEMI, or unstable angina. Inferior leads, 2, 3, AVF, show ischemic changes. NSTEMI management includes antiplatelet therapy, aspirin, ticagrelor, anticoagulation, and possible PCI depending on risk stratification, Grace score. STEMI requires emergent reperfusion, while NSTEMI is managed with a more nuanced approach.